One of the original therapies outlined in naturopathic medicine was heliotherapy. This means treating with sunlight. Many European sanitarians became famous for curing chronic diseases using the mysterious properties of sunlight. Of course, many of these were high up in the Bavarian Alps, where the air was a lot thinner and filtered out less of the sun's rays. Nevertheless, the successful use of sunlight for various health problems gave rise to research in conventional medicine in this country as to just what the actions of sunlight on the human body really were. This was an exciting time for science, and medicine was ready to adopt all the findings of the day. For example, when the different parts of the light spectrum are studied and the frequency ranges for ultraviolet and infrared were figured out at a certain point in time, they took their place in medical treatment. As we learned what the different parts of the spectrum of light did, these became applied to the treatment of diseases, and the use of light became part of conventional medicine, not just a part of natural medicine. Science made it possible to create the effects of sunbathing in the high Alps by reproducing the ultraviolet rays given off by the sun. UV therapy became an accepted therapy in conventional medicine. Yeah, they stole it from us, but that's all right. Many people were cured without having to go to Bavaria or the equator, and that's good. You can take a look here and see exactly what it looks like. That is some powerful ultraviolet. How do I look? Well, I don't want to singe my eyeballs. Over time, many therapies came to be used less and less, and the prescription pad became used more and more. Soon, the use of infrared or ultraviolet seemed less like something a hospital would use and more like something you would find in a health club or a gym. Ultraviolet treatments were given in medical settings for decades, until relatively recent times when they started telling you that it was bad for you. Ultraviolet is part of our protocol for treating arthritis, and there are solid reasons for it. Faulty calcium utilization is a part of arthritis, and it precedes it long before symptoms show up. The effect of long-wave ultraviolet, like we get from these machines, the effect of long-wave ultraviolet on the skin activates vitamin D stores in the body, and this, in turn, helps distribute the calcium molecules where they're supposed to go. When this process is disordered, calcium is drawn from other storage places and is deposited, distributed haphazardly, causing changes in the joints. Effective activation of vitamin D is essential for correcting a faulty calcium metabolism. In fact, ultraviolet therapy is more important than ever before. Artificial light has a frequency spectrum that's very different from sunlight, and artificial light makes one more disposed to metabolic dysfunctions. As human beings, we've adapted to natural light for thousands of years, but now, in the last 100 years, have been exposed to more unnatural light than the sun. Especially fluorescent lights create a very disruptive action on multiple systems in the body. This is well documented. and you'll probably notice that in the clinic, even though there are fluorescent lights on the ceiling, most of the places we don't turn them on. Word got out about the bad effects of the unbalanced light, particularly from fluorescence, and they started making the so-called daylight bulbs, which still contain that unbalanced spectrum and that 60-cycle flicker that's been shown to affect your endocrine system. And the so-called full spectrum lights are a bit better, but they still have some spikes in the red and blue portions of the spectrum, and are still very different from natural sunlight. And of course, you're just not getting ultraviolet in the quantity you need if you're spending most of your day in artificial light. So, once again, who's saying this? A quack doctor? No. The New England Journal of Medicine, February 1970 issue. This isn't some alternative medicine nonsense. The ill effects of unbalanced light have been scientifically scrutinized and published if you want to take the trouble. I mention it, though, to point out that there are a lot more cases of arthritis and other chronic diseases today, partly because there's a lot more light deprivation. And now they're mandating that you convert to fluorescent lights in your own home. Incandescent lights are not sunlight, but they are way healthier for you than fluorescent bulbs. So stock up now. Maybe I should be glad, because all of this means I will have an unending supply of new patients. But for right now, I can tell you that the ultraviolet therapy we do here with our arthritis patients is somewhat specialized. It's a very brief exposure because it was found that the amount needed of the right part of the ultraviolet spectrum was very little. So it's not like going to a tanning salon. You have a short exposure to a wavelength of light that creates a multitude of chemical actions in your body. Still, I recommend that you get out in the sunlight as often as possible, drink up those rays, and regardless of what time of year it is and what the sky looks like. Sometimes you can get a very good exposure of the right elements on even a cloudy day. The other treatments we are doing for your arthritis are activated and magnified by that exposure.